So this was a look at blood samples from the Empower Lung 1 study, which looked at Cemiplimab versus chemotherapy in PD-L1 high non-small cell lung cancer patients. This study assessed whether ctDNA dynamics could be used to better understand response to immunotherapy in these patients. Blood samples were collected at baseline and at week 3 and week 9 in these patients, and then analyzed through tumor-informed ctDNA assays. And what we found is that at week 3 and at week 9, you can already see changes in the ctDNA. Most patients had their ctDNA almost completely clear or were starting to go up. And that had started at week 3 and became even more pronounced at week 9. So we saw a very clear bimodal distribution in the immunotherapy-treated patients. In the chemotherapy-treated patients, almost everybody's ctDNA went down, but very few people had complete clearance. And what we found, as you might expect, is that these ctDNA dynamics also associated with outcome. So patients who had complete clearance of their ctDNA did very well over time, both in terms of progression-free and overall survival, and patients whose ctDNA were increasing obviously did the worst. There's a lot of interest in trying to understand whether this can improve on our radiographic response assessment, and we did see that these dynamics correlated with partial response and progressive disease, but patients with stable disease fell into either of those groups. So some patients with stable disease had their ctDNA go up, and other patients with stable disease had their ctDNA levels go down. And when we pulled out kind of a composite assessment of radiographic response and ctDNA, you could pull out the stable disease patients who did better, and you could also pull out from the partial response patients those who did worse. So we think that using ctDNA can help better identify the patients who truly are responding to immunotherapy and those who are not. It's important to say that those associations are really not as strong for chemotherapy. So it's more specific and a better biomarker for immunotherapy response than for chemo.